drugs for our hospitals. Right, Honorable Speaker, last week but one, I was in Masaka Regional Referral Hospital with a patient, but the situation I found there is so alarming. Patients are asked to buy drugs from private pharmacies, which is too costly to them. Right, Honorable Speaker, Masaka Regional Referral Hospital is struggling with the drug stockouts due to high number of people getting services from this hospital. Right, Honorable Speaker, we are in the budgeting process. Can we get a commitment from the minister that in this coming financial year, all hospitals, especially Masaka Regional Referral Hospital, will get enough drugs to save our people? Thank you, Right Honorable Speaker, for the opportunity.
Thank you. Honorable Zake.
Thank you, Right Honorable Speaker. Right Honorable Speaker, I'll begin from the same note. What everybody keeps talking about in our communities is about the lack of drugs in the hospitals. But my problem is about the issue in the statement that we've just had. There is always money budgeted to provide for drugs in these hospitals, generally, nationally. But in Mitiana Hospital, I've never received any report. All the calls I get from my voters, they get to that hospital, nobody receives drugs that are for free. First and foremost, money is always solicited from all the patients, almost all patients. On a monthly basis, I actually spend more than 10 million to provide drug money to buy drugs.
Some time back, 10 years ago, government initiated the construction of surgical ward. Up to now, they have not completed. It requires only 5.6 billion shillings to accommodate over 250. It is a 250 bed capacity. But up to now, they have not finished. And when you visit Mbale Regional Referral Hospital, patients are all over the corridors outside. And it's now raining, mosquitoes, those who are taking care. So I want the Honourable Minister to tell us exactly when is government providing that additional money. Some time back, Parliament tried to make a budgetary allocation for it, but the money was not released. Now, secondly, the policy of government is to have Health Center 3 in every sub-county and Health Center 4 in every constituency. Right, Honorable, you realize that Bulambuli has 3 constituencies, but with one Health Center 4. And the nature of our area, the Health Center 4 is based in the lower line, but up there, people are struggling, and recently we had the mudslides where the only access road was cut off. So the entire upper belt of Bulambuli, that is 16 sub-counties, they are on their own. No health facilities, everything else. They are on their own. So I want the Honorable Minister to also tell us what happened to that. Sometime back, there was a team from Ministry of Health and the UPDF, Engineering Brigade. They came and they visited some sites up there. And even informed the Wananchi that we are going to construct one of the facilities up there called Buluganya, where my place there. Now, it's now 3 years. They have never shown back. They are silent. So Wananchi are saying, were we duped? Or what is happening? So I need that clarity, because the death rate right now in Uramburi is so high. As I speak now, today in my place area, they are burying 7 people.
Information I'm trying to get, because there is something we agreed upon in this house. And that was the issue of the PET machine. We agreed that even if anything else fails, as a must, we must provide the money for the PET machine. Okay? And finance had told me they had provided 35 billion. Okay? And I communicated it here, because when I was following up, they had promised to top up, and we get the 62 billion. Now, the committee report shows indeed 62 billion has not been provided. The draft estimates, I cross-checked. I don't see it there, so I've asked finance to cross-check, because that's something we agreed upon here, and we must sort out. I hope we can stand our ground on that. We work with finance, that the money for the PET machine must be provided. All right, this business of sending people abroad for cancer treatment when it has already gone far, yet it could have been detected much early, we can't continue with that. So that one is a deal we've made without anyone really saying, I belong here, it's for all of us. So let finance take note of that, but I hope I'm going to get feedback before we finish debating this issue. Okay? Honorable Babiku,
Thank
followed
you.
by Honorable Alex.
Thank you.
Right, Honorable Speaker. I first of all thank the able chair of Health Committee for the submission, but on the other hand, I have a concern in my constituency. I'm aware that about 125 constituencies don't have health center force. But mine is a special one because of one next to DRC, and we have refugees coming in, year out. And they frustrate the services of the health sector. So this, there is a Health Center 3 called Muramba Health Center 3, which is the only one that is bordering the area where the refugees come from. So it's always suffocated, and it really requires to be upgraded to a Health Center 4. And also, Kisoro District, being just a center for refugees to go through, they don't actually go through. They stay permanently. So Kisoro requires actually to be a district as a refugee hosting district. That aside, that Muramba Health Center 3 gets deliveries of babies about 10 per week or plus when there are no refugees. When there are refugees, they go to even 30 per week deliveries. Those are per day deliveries. So, Right Honorable Speaker, I request that we be considered for upgrading that Health Center 3 to Health Center 4. Or at least a maternity be constructed in that area. Thank you, Right Honorable Speaker.
Thank you, Honorable Maxwell Chai.
Honorable Minister, this matter came to your office. We don't have reagents at district referral hospitals, the whole country. That's why many people die, because they get tested when they are referred. And what the district referral hospitals do is only to send the samples, which take 2 weeks for people to get their results. But also it is very expensive. One patient has to pay 250. Can we have provision for this? It's not only for Adjuman, but for the whole country. The committee raised the issue of how to rehabilitate the mortuaries. But right now, Speaker and colleagues, there is an occurrence of uniqueness in our districts in relation to some deaths associated with unique cases where people refuse to bury their deceased people immediately. Hospital tries to preserve the bodies, but to a limited extent. I'll propose for all the district referral hospitals, let's have fridges.
Thank you, Honorable Niyonsaba.
Focusing on the Uganda Cancer Institute, I have a patient right now in Mulago, and what I have seen over the past 2 weeks or so is actually very, very alarming. And therefore, when the committee comes up to say that we need to support the Cancer Institute, I fully support them too. Particularly now when they are calling for additional 42 billion shillings for wage, let us, colleagues, support this and request Minister of Health to reprioritize their priorities and ensure that the Cancer Institute is fully funded. The other recommendation that I want to support is with respect to increasing the ceiling of non-tax revenue by Minister of Finance. I would request that Minister of Finance considers this as a critical matter. Let them review their macro-fiscal framework and ensure that the ceiling is lifted so that the respective institutions actually get what can be used to finance health sector activities. In addition,
Just for, I want to move with you, Honorable, because I know you're an expert in budgeting. Honorable Maxwell Chai was one of the top officials in the budget office in the Ministry of Finance before coming here. Yeah, I just wanted to know on that NTR, because NTR must be generated by the institution that is requesting for it. Should we say the ceiling is below what they are generating, and then they end up not receiving their money back, which we usually do through supplementary? Otherwise, how shall we raise the ceiling for NTR if they are not generating it?
yeah, thank you very much, Mr. Speaker, for that question. From history, projection of non-tax revenue has actually been wanting, to the extent that sometimes you realize an amount which actually is far below the potential. It's very important.
Mr. Speaker, Honorable Maxwell is raising an issue. It's revenue which is collected by the ministry, and in most cases is remitted back for purposes of running the activities. And studies have been done. So the clarification I want to seek from you, my brother Maxwell, what has been collected for the last maybe 3 years that we as Parliament have not allowed it to be extended on Ministry of Finance? Because we need that as empirical evidence, because non-tax revenue, everybody needs it, because it will reduce the direct taxes and we shall use the non-tax revenue.
I leave that to the Minister of Finance to come and take it up. I'm not yet a Minister of Finance.
But you see, what Honorable Nandara has asked is what I asked. When you recommend that we raise the ceiling for NTR, okay? The question is, how much did they correct and what is the ceiling? Because usually, whenever the ceiling is low, we extend this money through supplementaries, which is a tedious process. So I would be, because all NTR, we ensure it goes back to the entity. So that recommendation, Honorable Max, that's why I refer to you as a budgeting expert. You should be.
Mr. Speaker, as I was saying, that Minister of Finance, for once, should have the capacity to make precise forecast of the non-tax revenue. Once that is done, we shall actually get away from these additional supplementals time in, time out. But that said, the report actually, to me, does not indicate to us in any way that the estimates from Ministry of Health or the health sector is equity responsive. A sub-region like Bukedi, which actually is very poor, disadvantaged, despite the enormous resource potential, seems to have been actually ignored in these estimates. How I wish Minister of Health could tell us when exactly Toro General Hospital will be upgraded to Bukedi Regional Referral Hospital. I thank you, Mr. Speaker.
Thank you.
Last year we had a backlog of intern doctors who are still seated waiting for placement. And this year there will be more graduating. And from the report, I'm not seeing any budgetary provision for placement of intern doctors. My question is to the Minister and the Chair, what is going to happen to the backlog and to the new interns students who will be graduating? Thank you, Right Honorable Speaker.
Thank you. Honorable Enos.
Thank you. Have to do with resources. I want to thank the team for bringing out the issue of underfunding to the Ministry of Health. Specifically on page 11, we failed even to meet our own international commitments. We signed treaties, specifically the Abuja Declaration, to have 15% of our budget sent to the health sector, but we've never met this target for over 24 years now. Right Honourable Speaker, my question is, if we've failed to meet the target of funding the sector, why don't we look at the alternatives? Why can't we fast track the health insurance, the National Health Insurance Bill? What's so hard? If we've tried for 24 years and we failed to have resources to meet the infrastructure needs of health, why can't we look at the alternatives? Honourable Minister, please guide us. Because the other day when we mentioned it to the President, he was saying that we need to first deal with wealth creation for every household. That will not happen. It will take ages. Yes, we can do wealth creation, but at the same time, we'll look at the alternatives that will bring solutions. The silver thread in having all these challenges resolved is in putting more resources or finding alternatives for the resources. Number two, Right Honourable Speaker, is our challenge of spreading too thin and actually achieving nothing. When you go to our health centers at the district level, getting even I don't know, I would use equipment that can do the simplest diagnosis. It's also becoming a problem. CT scans are failing us. Somebody in the Antonda gets an injury, a brain injury, we have to send them to Mbarara. They go to Mbarara, then even Mbarara Regional Hospital cannot even give them a scan. They have to send them to private clinics to do the scan, which is almost 700,000. To an ordinary Ugandan, honestly, moving from Yantonde, you get to Mbarara, and then they tell you, you go to a private hospital to get treatment. It's not helping us. Even the 1 million things we are putting into PDM to do wealth creation, it's not helping them because they are spending a lot of money on health, yet we are not helping them. So my call on the Honourable Minister and government, let's fast track health insurance. Let's help our people. We deal with infrastructure. All that we are going to mention here has a lot to do with infrastructure. The health center force that they had started on upgrade, they are right now on standstill. When we keep pushing Ministry of Health, the issue is we don't have money. When we go to Ministry of Finance, they tell us we have no resources. So what do we do? Every day we are digging deep in our pockets.
Thank you.
18. I think that is something we should take note of so that whatever we have done can make meaning, because we need the chain to the end so that the last person can receive treatment. Finally, on the issue of the USAID funding, Right Honourable Speaker, the committee has recommended that the government should absorb some of these activities that were funded under that project. That is very, very important because I know under USAID funding, there were staffs that were paid in health sector, in the health centers or in the hospitals. Now that this money is not there, we cannot be here sitting and not filling that gap. That will mean some staffs will not be working, and it is going to create a big gap in the country. Thank you very much.
Thank you, Honorable Nyachkongoro.
We were invited, we raised momentum for the people. We went and told people that they are going to receive ambulances, but up to now, nothing's being mentioned. And we went to the Ministry of Health, by the way. Now, this goes back to the members of parliament where they think that some members from certain constituencies are not working hard because they have not delivered. Yet, we were all invited as members of parliament that they promised that each constituency is going to get an ambulance. Right, Honorable Speaker, when it comes to access to health, previously, we thought that it was distance from homes to access health centers. Now that government has put up infrastructure, the issue of staffing, like my sister has said, I want to thank the Minister, Honorable Nifa Kawaya, who came to open some of the health facilities in our area that were built by government. But most of them don't have staff and equipment. And we really wonder why does government spend money on infrastructure development without planning for other factors like equipment and staffing. I don't know when government will lift the ban, especially on employing health workers. And we know that health is wealth. Right, Honorable Speaker, the issue of 2 billion for community health workers, I think 2 billion can be really considered to facilitate the community health workers so that they can continue doing the work. We know that funding has reduced with the Trump's orders, particularly with and other and other funders. But as government, I remember we had planned for the contingency fund that each year we should budget for the contingency fund to supplement these uncalled for, what can I call them? Disasters. Is it a disaster? It's not a disaster. Gaps. Budget gaps. Is that so?
Unforeseen.
Unforeseen. Thank you, Right Honorable Speaker. That's why you are so brilliant. For the unforeseen gaps. So, Right Honorable Speaker, on my phone I was showing it to my neighbor here that there is my constituency members who are sending me a message that the ARVs have reduced in places where they were getting them. They cannot access them. As a country, we had fought the battle.
Kasaja says colleagues' money will come. Okay, yes.
Committee for their report. And Right Honorable Speaker, I want to entirely agree with you. We must prioritize the purchase of the PET machine so that we end the challenge that Ugandans face. There is actually wrong diagnosis going on in this country. By the time they discover that somebody has cancer, this person has reached stage 3, stage 4, Right Honorable Speaker. So 62 billion gap, we must find this money because what is available is 30 billion. What they need is 92 billion. Let us put aside everything for the sake of ensuring that there is a proper diagnosis. And of course, we have been told that the cancer patients annually, they receive 7,000, and those are those that are diagnosed. But there are people who have cancer out there, and they even don't know. So, Right Honorable Speaker, the second issue, can we focus instead of doing so many things at the same time? Cancer Institute already has a regional center fully constructed and commissioned in Omoro, another one in Mbarara. What they need, Right Honorable Speaker, is there is a gap of 15 billion, 15.9. What has been provided is 9 billion. Can we prioritize that?
Because what goes on at the Cancer Institute, colleagues, if you get there, you'll actually feel sorry. It is terrible. It shouldn't be a center of excellence for the treatment of oncology and training of oncologists in the East African region. So, Right Honorable Speaker, I want to support the committee report that let's prioritize. For the Heart Institute, Right Honorable Speaker, they just want to start constructing. Can we focus on the Naguru facility and have it operational first before we think of starting other centers outside? Because for the others, they're already running, like Cancer Institute, I talked about the two. For the Heart Institute, can we first prioritize that and have it operational before we think of the Hoima and another center that they are thinking about? Right Honorable Speaker, I want to move to the other. The digital X-ray machines. Thank you, Minister of Health, for procuring these equipments. Right Honorable Speaker, we've had a challenge of X-rays in this country. When I was Minister of State for Health, we took a new digital X-ray machine to Tororo. Unfortunately, 5 years down the road, this equipment has never worked. Just a small...
Thank you, Honorable Taylor, followed by Honorable Mutawe.
To a neighboring country, Right Honorable Speaker, we normally budget here for Arua district. I know that includes other districts that border other countries. But Right Honorable Speaker, with the porous borders that we have, normally when we get drugs, our neighbors, especially from DRC Congo, for my case in Arua district, they get this information. You see the population increases, within a week or two, the medication is done. So for me, that is a big point to note, that we need a clear policy on how foreigners can get...
Of Kalangala are proud of you. I want to commend the committee for such a wonderful report, especially to the hard-to-reach areas. We feel represented very well. The Honorable Chair, thank you for listening to our cry, especially, Mr. Speaker, the issue of ambulances that were not fueled. They were not given fuel in the ND4, but now that you have brought it out, we are grateful and we are hopeful that this fuel is going to come to us, not only in words, Mr. Speaker, but in action. On page, Mr. Speaker, on 29th March 2025, I wanted to give you why we are saying we are happy that we are going to get fuel. There is a lady who was coming from Banda Island. She was going to give birth, but she gave birth in the middle of the lake and in a very ugly boat. So when we have these ambulances functional and very well fueled, we are going to be happy and honored to get them. Mr. Speaker, secondly, on page 21, you gave a recommendation that the committee recommends that the ministry should allocate specific time and days when the boat ambulances should move so that the public is aware of the schedule. Mr. Speaker, a health condition cannot be allocated time. You cannot tell somebody to get sick tomorrow. So why, I don't agree with the committee on this recommendation. Because say, for example, in the islands, you cannot tell somebody to get sick and the ambulance moves or doesn't move. The ambulance must be stationed somewhere ready to move at any time. Yeah? Because if, for example, somebody gets COVID-19 and they have the signs, you mean you're going to wait for Sunday and it is a Monday? So I believe, I think, Mr. Speaker, this recommendation should be removed from the committee report because it doesn't really make sense for me as a member of parliament from the hard-to-reach areas. I thank you so much, Mr. Speaker.
Thank you. Honor, don't mind